Welcome back to my channel. Today we are going to start with the dental companion series, and in this series, this is from DAMS publications, and uh, we are going to start with prosthodontic as we are going on with perio as well along with this. So go and watch that video as well to complete your perio fatafat. And prosto, while we will first complete the CS and then pulse and then pulp. Okay, so basically we are starting with the prosthodontic, which has major two topics, which is complete dentures and removable partial dentures. And complete dentures we are going to start today. Anatomic landmarks in maxilla and mandible and their clinical signification will be the topic of today's video. Now there are two types in it: supporting structures and limiting structures. There will be the supporting structures and there will be the limiting structures. Limiting structures, which are the stress bearing structures. We are going to start with the limiting structures. The first is the labial frenum. Labial frenum is, I will attach the image somewhere in the corner. The fold of the mucous membrane at the medial line. The fold of the mucous membrane. Here, the fold of the mucous membrane at the medial line, it moves with the muscle of the lip. Adequate relief for muscle activity, proper denture seal, and excessive relief weakens the denture base. If proper seal is very essential, otherwise there will be the it weakens the denture base if the excessive relief is given. So adequate relief will give the proper denture seal. Now, buccal frenum, which is a single or double fold of mucous membrane, broad and fan shaped. Now, moves with muscles of cheek during the speech and mastication. It moves with the mews during the mastication and also with the cheeks. Muscles which are attached is levator anguli oris, orbicularis oris, and buccinator. Single or double bend. Moves with speech and mastication, and the muscles attached is levator anguli oris, orbicularis oris, and buccinator. Okay, adequate relief for muscle activity, more clearance. Now the labial vestibule, which is a labial buccal frenum. Here this part is known as okay. So labial buccal frenum, the vestibule, labial vestibule, mucogingival line limits upper border. Mucogingival line limits the upper border. Record adequate depth and width, and overextension causes instability and soreness, and proper contouring gives optimal aesthetics. If the proper contouring is given, we will just see the denture will be like this. So here the proper vestibule, proper contouring is given, it will look aesthetic. It records the adequate width and depth. If we overextend it, it gives the soreness and instability as well. Okay, now buccal vestibule, obviously backside. Buccal frenum to hamular notch. So, I will attach the image because I'm not not able to explain it in its 3D form. So adequate adequate depth and width. Improper extension causes instability and soreness. Same ways. Hamular notch, it is the distal to the maxillary tuberosity. We can just remember that there is this type of depth, and here this is a jaw, there is a little depression here. So here it will be the distal to the maxillary tuberosity between tuberosity and the hamulus of the medial pterygoid plate. This notch is known as hamular notch. It is distal to the maxillary tuberosity between tuberosity and hamulus of medial pterygoid plate. Tuberosity and hamulus of medial pterygoid plate. Aids in locating posterior palatal seal, PPS. Okay, overextension causes soreness. Hamular notch, okay, vibrating line. Junction of movable and immovable part of the soft palate. Here is the soft palate. Soft palate starts from here, and here there will be the junction of movable and immovable part. You can feel on your keep the hand on the soft palate and then try to speak. You will be able to observe the movable and immovable part. 2 mm anterior to the fovea palatina, not universal finding, okay. 2 mm anterior to the fovea palatina aids to establish PPS. Distal end of the denture extended at least to vibrating line, okay. So we really need to extend the denture at least to the vibrating. PPS, it's a post palatal seal area from hamular notch to hamular notch, from this side of hamular notch to this side of hamular notch, anterior to vibrating line. It will be here is the vibrating line, the PPS will be here. Aids in retention, most important part for retention is PPS. Divided into two areas, pterygomaxillary seal and post-palatal seal. So PPS is pterygo. It's an area. PPS-A involves the pterygomaxillary seal and PPS. Okay, PPS-A has a pterygomaxillary and post-palatal seal. Pterygomaxillary seal extends through here. Pterygomaxillary notch and continuing 3 to 4 mm anterior laterally approx the mucogingival junction. While PPS, if it is area between the anterior and posterior, between anterior and posterior vibrating line, the area is known as PPS. And found medially from one tuberosity to another. Vibrating line, it is an imaginary line across the posterior part of the palate. Imaginary line across the posterior part of the palate, making the division between the movable and immovable. Okay, so vibrating line, an imaginary line across the posterior part of the palate, making the division between the movable and immovable tissues. Between the movable and immovable tissue, the separating line is known as vibrating line. Anterior vibrating line, it is an imaginary line located at the junction of attached tissue overlying the hard palate and movable tissues of immediately adjacent soft palate. It is a junction between the immovable part, attached tissue on the immovable part of the hard palate and the movable tissues of the immediate soft palate. It is not a straight line due to the posterior nasal spine. It's obviously not a straight line. Always on soft palate, posterior vibrating line. It is an imaginary line at the junction of the tensor villi palatini muscles and muscular portion of the soft palate. Posterior vibrating line is the imaginary line at the junction of tensor villi palatini and muscular portion of the soft palate. Methods to locate the vibrating lines. Patient in upright position. Patient should be in upright position. With the help of the T-burnisher, hamular notch are located and marked with pencil. T-burnisher, the hamular notch are located and marked with pencil. Extend 3-4 mm anterolateral the line to mucogingival junction and do the same on the opposite side. Ask the patient to say ah with short vigorous burst to demarcate the anterior vibrating line. For the posterior vibrating line, a short burst is normal, unexaggerated manner. Nasal blow, Valsalva, when your patient asked to close nostril and blow the air gently. Close the nostril and blow through the nose. This brings the soft palate downward and give the vibrating line. Nasal blow. Now the swelling is the method to record the posterior vibrating line. Nasal blow for the vibrating line, swelling for the posterior, and palpation with the help of the T-burnisher locate the palatal tissue between anterior and posterior vibrating line. ओके सो सबसे पहले हम लोग अपराइट पोजीशन में रखेंगे. टीप बर्निशर से हेमिलर नॉच को लोकेट करके मार्क्ड विद पेंसिल एंड देन एक्सटेंड द 3-4 mm एंटीरियर लेटरल द लाइन टू म्यूकोजिंजिवल जंक्शन. फिर एकदम शॉर्ट वाइग्रस बर्स्ट में बोलेंगे तो एंटीरियर वाइब्रेटिंग लाइन आ जाएगी. नॉर्मल बर्स्ट अनएग्जेजरेटेड मैनर में आप बोलेंगे तो पोस्टीरियर वाइब्रेटिंग लाइन आ जाएगी. नेजल ब्लो देंगे कि जिसके अंदर नॉस्ट्रिल क्लोज करके ब्लो द एयर जेंटली, तो उसकी वजह से सॉफ्ट पैलेट डाउनवर्ड आ जाएगा. वी विल गिव द वाइब्रेटिंग लाइन एंड स्वॉलोइंग से पोस्टीरियर वाइब्रेटिंग लाइन का रिकॉर्ड कर लेंगे. पाल्पेशन से पाल्पेशन कैसे करेंगे? टी बर्निशर को लोकेट करेंगे. पहले टी बर्निशर को यूज़ करके पैलेटल टिश्यू को लोकेट करें. Rationale and importance of PPS. Addition of the PPS transforms a base with excessive retention. Stable base with resistance to horizontal forces. So mainly the stability and retention uh, is due to the PPS. It forms only the partial vacuum when subjected to force and enhance the retention and stability. Now, maintains contact with soft tissue during the functional movements of the stomatognathing system, decreases the gag reflex, decrease the food accumulation with adequate compressibility, decreases patient discomfort of the tongue, provide thicker border which will compensate for the processing shrinkage of acrylic resin in this area. Increase the retention and stability by creating partial vacuum. The thickened area provide the added strength. Okay, स्टेबल बेस मिलेगा, पार्शियल वैक्यूम विल क्रिएट एंड स्टेबिलिटी विल इंक्रीज, फिर कॉन्टैक्ट रहेगा जिसकी वजह से स्टोमेटोग्नाथिक स्टिफनेस की मूवमेंट्स में वो हेल्प करेगा, गैग रिफ्लेक्स कम कर देगा, फूड एक्यूमुलेशन कम कर देगा, डिस्कम्फर्ट ऑफ द टंग, फिर ज़्यादा थिक एरिया मिलेगा जिसकी वजह से प्रोसेसिंग के जो श्रिंकेज होगा वो भी कंपनसेट कर सकेंगे. एंड रिटेंशन स्टेबिलिटी क्रिएट द पार्शियल वैक्यूम. द थिक एंड एरिया प्रोवाइड एडेड स्ट्रेंथ. What is the effects of the head position? So the Silverman describe the effect of the head on PPS recording. The impression of the soft palate should be in its most functionally depressed position. Function of soft palate requires the freedom of movement in 3 dimensions. So the denture which contact is must conform to the requirement. The max depression is achieved when the FH plane is 30 degree. FH plane is 30 degree. Now, the below the horizontal plane and the tongue is firmly positioned against the mandibular. The flexion also contributes to moving excess material and saliva out of the mouth rather than to the pharynx. How to record the PPS? Conventional technique, which is the Winkler technique. Fluid wax technique. Arbitrary scoring of the cast. Extended palatal technique by Silverman, and ultrasound technique. Okay. There are 5 methods. One is conventional technique, which is the Winkler, fluid wax technique, extended palatal technique by Silverman, arbitrary scoring of the cast, ultrasound technique. Conventional, fluid wax, arbitrary scoring, extended palate by Silverman. Note, gagging occurs, thickness of the denture base, overextension of denture, post-damming, surface finish. When gagging will occur if there is thickness of the denture base. If the denture is overextended, if there is post damming, and if there is surface finish. Management, clinical technique, prosthodontic management, pharmacological measure, and psychological hypnosis. Clinical technique, there are 3 management. Prosthodontic management, we can do it, and pharmacologic measures and psychological, which is hypnosis. Clinical surgical, the basis of this technique stems from the observation that persistent gagging results anatomy can relax soft palate rest back on the pharyngeal wall. करेक्शन, शॉर्टन एंड लाइटन द सॉफ्ट पैलेट. सबसे पहले सर्जिकल के अंदर जो बहुत ज़्यादा सॉफ्ट पैलेट का रेस्ट बैक टू द फेरेंजियल वॉल, उसके लिए हम लोग क्या करेंगे कि सॉफ्ट पैलेट को शॉर्ट और टाइट कर दें. दिस इज द सर्जिकल. प्रोस्थोडोंटिक सिंगल मार्बल टेक्निक, वी विल यूज द सिंगल मार्बल टेक्निक. Prosthodontic management, matte finish dentures, we will be giving the matte finish dentures. Increased interocclusal distance, the interocclusal distance should be increased. Pharmacological measure is LA. Pharmacological measures is LA. Centrally acting is antihistamines, sedatives, and transducer central nervous system. This was all about the limiting structures, and the next will be the relief structures, which will be in the part 2 of the video. And so the date is announced. For the detailed video of the date, go and watch my short. Okay.